All right, everyone, we're going to get started. Again, my name is Sarah. I'm with Quirk Healthcare, and this presentation will be uploaded to our YouTube channel along with SlideShare. If you want to watch it again, if you think that you missed anything, it's helpful. And presenting today is Jeff Rowland. He is a project coordinator with Quirk Healthcare. He will be presenting on patient tracking solutions today. So, Jeff, we are ready when you are.
All right, thank you, Sarah. Good afternoon, everyone, and welcome to another Quirk Healthcare Insights webinar. Like Sarah said, today we'll be discussing patient tracking and how it can impact your practice. And just as a reminder, as our disclaimer states, everything that we present here is publicly available information, and best practices is not intended as legally binding or prescriptive advice. Let's get started. So as we proceed through this webinar, some of our goals today will be, 1, to define patient tracking, 2, to discuss benefits and their importance to your practice, and then 3, to outline key reports that are vital to analyzing, improving productivity, and then finally, taking a quick look at what the future holds for patient tracking systems. So what exactly is patient tracking? Patient tracking, as it pertains to our conversation today, refers to technology-based systems that track and locate patients as they move throughout the medical facility. Most importantly, patient tracking systems provide an excellent tool to measure your practice efficiency and adjust accordingly. Currently, there are 2 types of patient tracking systems in use. The first is real-time location systems, also known as RTLS, which are systems that rely on technology to automatically gather and communicate data. And then the second is semi-real-time tracking systems, which also use technology but gather data through manual input. At present, tracking systems are being implemented right around 5%. However, the trend is expected to grow in the near future. Now that we've defined some patient tracking, let's look at some of the features available in these types of systems. While using tracking systems, the most common features users will usually experience are graphics that display facility floor plans, system metrics, and visible patient and staff location. On the other hand, some of the more advanced tracking systems have features that integrate lab work, track hand hygiene, and incorporate patient alert systems in case of emergencies. Now that we've discussed some key features, we'll turn our focus on some of the key benefits provided by patient tracking systems. First benefit to consider is the impact these systems have on the quality of care and the safety of the patient. Some ways that these 2 areas experience improvement are through increased patient-provider interaction times, which also improve patient education, faster order execution, and an overall improvement in care response times. And then lastly, these systems allow for enhanced tracking of infectious disease through constant monitoring and the ability to see location status. Second benefit that we'll discuss is the increase of patient satisfaction. This is accomplished in several ways. For example, these systems lead to shorter patient wait times and total length of stay due to increased work efficiency within your practice. Second, they keep patients and their families more informed throughout the process and their stay. And lastly, minimizing patient misplacement and oversight, which can potentially lead to patients walking out without being seen during the visit. Ultimately, all of these benefits lead to higher HCAT scores and other customer service scores that are vital to a successful practice. Our third benefit we'll discuss today is the overall impact that these type of systems can have on your staff. First, the data that is gathered by these systems provide important details that can lead to stronger understanding of staff performance, as well as peak volume times for customers, which in return help to promote an effective scheduling practice. In fact, if you look, some studies, patients have shown that patient tracking systems have been proven to speed up bed turnover times by nearly 50%. Ultimately, all these benefits add up to happier staff, which leads to stronger teamwork and minimizes employee turnover for your practice. Sorry about that. Moving on. So up to this point in the presentation, we mainly focused on the patient and the staff benefits. One of the last areas we'll highlight is the overall financial impact that these systems can have on your practice. The implementation as well as proper management of these type of systems, for one, help to increase customer throughput, which in return leads to faster revenue growth. In addition, the benefit of higher customer satisfaction ratings positively impact Medicare payments. And then finally, improved efficiency helps in surpassing quality measures while reducing potential liability. So based on this information, it should be no surprise that 95% of organizations that have implemented these systems have seen a positive return on their investments. So now that we've outlined the benefits of these systems, here we want to point out a few important reports that your practices may use to create long-term change and potentially streamline your practice's processes. Obviously, you want to pay attention to the patient's total length of stay, but we feel it is equally important to evaluate the average and max wait times during check-in, the period between intake and physician arrival, and then last, the length of checkout. And when you combine these metrics with the last two reports, which are the number of patient handoffs and the number of patient walkouts, we will believe it will help your practice discover workflow bottlenecks and ultimately lead to a sustainable performance improvement. Here we give just a few examples of some of the patient tracking vendors that are currently on the market. Just a short list. In addition to these, many EHRs that are provided today have some level of patient tracking integrated into the system. On the next slide, I will introduce in more detail another patient tracking system that I am more familiar with, which is the Quirk Healthcare Bedboard. The Bedboard, which is a system that we support, is a web-based patient tracking system that combines both the patient tracking aspect and cycle time data in an easy-to-read format. The Bedboard has been designed to work alongside EHRs and can be displayed on large monitors or individual workstations according to however you need. As you will see on the next slide, the interface consists of 4 sections. The first is the floor plan, which displays patient and provider location during the visit. Second is a metrics dashboard displayed as easy-to-read dials. Third is a matrix that provides acuity, assigned provider, and location data. And then finally, a real-time feed of clinical actions is also provided. Here we've given you a snapshot of Quirk Healthcare's Bedboard user interface. As you can see in the center of the interface, the 4 dials provide the user with both average and max wait times, the number of patients waiting, as well as the number of patients currently in the room. To the left, you'll see the previously mentioned floor plan information that shows provider and patient location and has the rooms that are occupied highlighted. To the right displays the real-time feed within the actual system would scroll as events are updated. And then at the bottom section, you'll see the matrix part of the interface, which really just kind of gives a summary of what's going on, which includes patient status, patient name, current location, as well as physician attending. So what does the future hold for patient tracking systems? First, patient tracking systems will continue to be growing technology. This is in both advancements as well as the frequency within the healthcare industry. One specific technology that we'll see more of is the use of RFID chips as tracking devices in the form of either wearable badges or bracelets. These tracking devices truly automate the tracking of personnel and the communication of data instantly throughout the facility. In actuality, these systems are currently available today, but are more commonly used for tracking equipment and healthcare staff. However, as we progress in the near future, we'll see more use in tracking actual patients. These tracking systems will also grow more sophisticated and be used to integrate the automation of certain processes and procedures. An example of this is the previously mentioned hand hygiene compliance check at the beginning of the webinar. This allows hand sanitizers to use technology in order to detect a staff member's entrance into a room and automatically communicate and track the need to wash their hands. Finally, and probably a little further in the future, there's also the potential of pairing the RFID tracking chip with a technology device that can store the patient's personal and biomedical information as they move through their visit. Like the RFID chips, these devices can easily exist today. The biggest concern is for patient privacy, and that's going to be an ongoing hurdle for the future outlook of this type of technology. So that concludes the webinar for today. I know it's somewhat short, but I want to thank you guys for your time, and hopefully you all were able to come away with some good information that will be an asset to each of your practices. And at this time, we'll take a few minutes to field some questions. So let's go ahead.
All right, well, it doesn't seem like anyone has any questions today, but if you do, you can look at that email address, ben.quirk@quirkhealthcare.com, and feel free to send any questions or comments there. Thank you, everyone, for joining today, and thank you, Jeff, and everyone have a great day. Thanks so much. Bye.